Hello, my name's Neil Hamilton. I'm the consultant pharmacist at the Pulmonary Hypertension Unit in Sheffield. I've been asked by the PHA to give an update on the medication issues that have arisen from the coronavirus outbreak, and I will be addressing the most common themes and questions that many patients with PH and their families have been asking over the past few days. But before I get onto the questions themselves, I just wanted to let you know that all of us working at the PH centres are doing everything we can for you. There is a greater sense of togetherness than ever before in an already tight-knit clinical community. You can be assured that our PH professionals group of nurses, pharmacists and physios is working in tandem with the doctors and crucially with the team at the PHA to do all that we can to help every one of our patients through this difficult period. So, to the medication queries that we're being asked, and I've tried to take these specifically from the angle of the PH patients, but inevitably there will be some more general ideas that can be applied. But the first question that is really at the forefront of everyone's minds is about what is the advice regarding repeat prescriptions and home care delivery? Well, I can summarise in that at the moment, the advice from NHS England is that this stays exactly the same. So, in terms of your home care delivery prescriptions, if you normally receive deliveries every month, they stay every month, and if you normally receive them every 3 months, it stays like that. This also applies to GPs who have been asked to continue giving out monthly repeat prescriptions. But what I would say is try and request your repeat in plenty of time, just in case there are staff shortages anywhere along the way, either at the surgery or in the local pharmacy, or with any delivery drivers, just that might cause a delay in the medication getting to you. And if you're unable or if you've been advised not to go out, then obviously allow plenty of time to arrange with friends or family, someone to go and collect your medication. If you normally collect, it might be possible to ask your local pharmacy whether they could deliver them to you if you're in the situation of being advised not to go down to the pharmacy at the moment and collect them in the normal way. Second question, what medications are safe for me to take if I get symptoms of the coronavirus? Well, the answer to this is quite limited, to be honest. We would advise paracetamol, codeine, whatever you'd normally take for a high temperature or a headache. Ideally, don't take ibuprofen. That's fairly standard advice in pulmonary hypertension. A one-off dose might be okay, but don't take them regularly. There's a suggestion that ibuprofen can make patients with PH more breathless, so we generally avoid them. Similarly, they can have effects on the kidneys, and lots of our patients are already taking diuretics and other medications that can affect the kidneys, so that combination may not go well. Some of you might have seen in the press there's been some links with ibuprofen and coronavirus. What I'd say about that is that the evidence is not clear. But what does seem to me to be fairly clear is that ibuprofen in the context of PH generally isn't a good idea, so to avoid for that reason alone. Third question, I have heard about some medicines that may be a treatment for coronavirus, and what do I know about those? Well, there is no proven treatment at the moment for coronavirus. Obviously, it's very, very new, but several treatments that we use for other conditions, so treatments we're aware of, and there are also some new experimental drugs that are all being tested. I can also confirm that today we've seen the first tests of a vaccine being put into humans. All this is obviously very experimental. There's no good evidence for any of these treatments at the moment. But if and when a team at a hospital decide that one of these treatments might be needed for you, they will have weighed up all the pros and cons, and they will have understood all your other conditions, including PH, before that medicine has been prescribed. And they will have checked with the pharmacy team there in terms of interactions or any reasons why there may be problems of taking certain doses of different medicines. So not all of the medicines that are being tested and tried to manage this, the virus, will have been used in the context of pH before. But what I would reassure you is that each case will be carefully evaluated in terms of the risks and likely benefits. Question 4. So how about all my other medicines? Should I continue to take everything else as normal? Yes, absolutely. And I would encourage everyone to focus really carefully on compliance with their, what we call compliance or concordance with their other medicines. So if you've been asked and prescribed to take a medicine once a day, then it should be taken once a day. If you've been asked to take it twice a day, do try and take it twice a day. Really look after yourselves. Follow the advice you've been given for your other medications. And if you're otherwise fit and well, please stick to what you're doing. If you do have inhalers for asthma or COPD, then please really focus on inhaler technique, using the inhalers exactly as you've been shown to make sure you keep your lungs as well as can be done. If it would help to put reminders in your phone or maybe your laptop to just remind you to make sure you take other medications, then some people find them extremely useful. What I would say is just that, GPs and other healthcare professionals are going to be overrun in the coming months. So anything you can do for any other conditions that you might have in terms of medications and treatments, please do all you can to just keep yourself fit and well. And certainly do carry on with all the medicines other than just your pH ones that you're prescribed. One of the important questions, and I know the chairman, Ian Armstrong, touched on this in another of these updates, PHA updates, is about taking medication to suppress the immune system. Should you still be taking it? Again, yes, absolutely, you should be taking it because although suppressing the immune system may put you at higher risk of catching any infections, not just the coronavirus, there will be a really important reason why you will be taking them. You should not stop taking the medicines under any circumstances. And if you do still have concerns after however I've reassured and Ian has reassured you, then please speak to the team who prescribe it for you. So it might be your rheumatology clinic, perhaps hematology, but have a chat with them about your concerns and try and get some reassurance. But we would encourage you to absolutely carry on taking any medication that you've been prescribed for your own well-being at this time. Sixth one I've got is around taking vitamins or supplements such as garlic and echinacea. What I would say is that there is often not a lot of strong evidence to support vitamins and supplements, but if you normally take them and you're otherwise fit and well, then please continue to take them. We often get asked about supplements, and I would say that if they work for you and they're part of your routine, then as I say, please continue to take them. I'd advise you against starting anything new which might rock the boat, so to speak, which might destabilize anything. People with pH often don't need too much in the way of an insult or a change to feel a bit different, maybe a bit less well, and this is not a good time to be making those sorts of changes. So if you're currently on these supplements, vitamins, minerals, then great, please continue. And they're obviously not doing any harm, but I wouldn't advise to start taking them. We've had a lot of questions through on our blood monitoring line about the ERA blood monitoring. So ERA is endothelin receptor antagonists. These are bosentan, ambrisentan, macitentan, and patients taking those are asked for regular blood tests to check for liver problems and anemia. Some centres check these bloods monthly, some check 3 monthly, but it's likely to be more risky for you to go and get a blood test if you're otherwise fit and well and some of obviously of our older patients have been advised not to go out. So these bloods really are not a clinical priority at this stage. We've taken the stance in Sheffield to move to 3 monthly bloods for everybody. So you don't need to worry if you usually go every month and you can't get there. What we're currently advising, this might change with time, is we're currently advising 12 weeks between blood tests. So if you had a blood test in the past 2 or 3 weeks, then it's another 9 or 10 weeks until you need the next one. We will keep you updated as things change on this website and at your local centre as well. But that's the current advice that we're offering. So 3 monthly blood tests for bosentan, macitentan, and bosentan. 8th on the list I've got is what is your advice about INR monitoring? And here it's not quite so straightforward because everyone is so different. Some patients are very stable on warfarin, and INR is a blood test to make sure that the warfarin is working right. Some patients are very stable and can go a long time between blood tests. Some less so because their INR is less stable, or perhaps they've only just started taking warfarin for the first time. So my advice here is that you need to contact your usual monitoring clinic for advice, and they can advise you on an appropriate frequency for the blood tests. Above all, please follow all their advice in order to keep your INR as stable as possible. And standard advice that you would have been given when you started on warfarin around drinking, around dieting, just keep everything really steady in order that the INR level keeps as steady and constant as we can get. So there are the most common questions we've had, but lastly, but by no means least, I just wanted to reinforce the messages that you've probably been hearing very frequently. So firstly, in the importance of hand hygiene, really thoroughly washing your hands with soap. A 20-second wash is being recommended. If you're out and about and you can't wash your hands with soap and water, then use the alcohol gel. But hand hygiene is more important than ever, so please focus on that. If you do sneeze or cough, try and have some tissues to hand, and if you sneeze into a tissue, catch it in the tissue and bin that tissue immediately. Don't carry it around with you. And if it's possible, when you have sneezed or coughed, wash your hands again. If you haven't got tissues to hand, try and cough or sneeze into the bend in the inside of your elbow rather than in your hands at all. That's quite helpful advice, and also about not touching your face around your mouth and nose with potentially dirty hands. It will be difficult if some people are either locked down or told to mostly stay in, isolate to maintain a healthy lifestyle. Just try and do your best in terms of eating sensibly, general, healthy lifestyle. If you can get outside for some fresh air, then that's great for, from a psychological perspective as well as physical, having a little walk around in a garden or up and down the road without too much contact with other people, then that'll be really important, particularly as the longer that this goes on. And lastly, in terms of lifestyle, really important for me to mention about smoking. It seems clear from evidence from cases in China and Italy that smokers who contract the coronavirus often run into more problems than non-smokers. So I'd encourage any of you who are still smoking to use this as a really important driver and a reason to give up. It's never too late to stop. There's lots of advice and products that are available through the local pharmacy where you can get smoking cessation help. And if you can't physically get down there just at the moment, a friend or family member could go on your behalf. So, anyone who's still smoking, I'd say it's really important that use this as an opportunity to try and give up. So that really brings my update from a pharmacy perspective to an end for now, but the coronavirus picture and the advice is changing rapidly. We're going to be keeping this page as regularly updated as we can, all these PHA advice pages. So please do keep coming back to this section, and please look after yourselves and each other. Bye for now.